You think that if something is wrong with your heart, your body will warn you first. A sharp pain in your chest, a signal strong enough that you cannot ignore it. That is what most people believe, and it is what we have been taught to expect. But after the age of 60, that belief can be dangerously misleading, because some of the most serious cardiac events do not come with any warning at all. They happen quietly while you are asleep, without pain, without signals, and without giving you a second chance to react. What makes this even more concerning is that these events are often not random. They are very often linked to small, ordinary habits that happen in the hours before you go to bed. Things that feel routine, harmless, even healthy. The kind of habits you repeat every single night without ever thinking about what they might be doing to your heart. My name is Dr. Michael Harris. I am a cardiac surgeon, and for more than 20 years, I have worked in operating rooms at all hours of the night, treating patients whose hearts failed while they were asleep. Over time, I began to notice something that was difficult to ignore. The same patterns kept appearing again and again. Not rare conditions, not unpredictable events, but simple behaviors that could have been changed if the patient had known what to look for. Tonight, I want to walk you through 7 of those habits. 7 things that may already be part of your nightly routine, especially if you are over 60. More importantly, I am going to show you how to correct each one in a way that is practical, realistic, and immediately useful. Because once you understand what is happening inside your body at night, you will realize that protecting your heart is not about doing something extreme. It is about making a few small decisions at the right time. Before we get into those habits, you need to understand one important thing. The night is not just a time when your body rests. For your heart, it is a very specific physiological state. And after 60, it becomes a period where your margin for error is much smaller than most people realize. To understand why these habits matter so much, you need to look at what actually happens inside your body when you fall asleep. Most people assume that the heart simply slows down and rests. But that is only part of the picture. In a healthy system, nighttime is when your cardiovascular system shifts into a recovery mode. Blood pressure naturally drops, your heart rate slows, and your blood vessels relax. This process is not random. It is a carefully regulated cycle that allows your heart to repair and reset after the demands of the day. However, after the age of 60, this system becomes less reliable. Blood vessels tend to stiffen. Pressure. Regulation becomes less precise, and the protective hormonal signals that once supported your heart during the night begin to weaken. As a result, your body has a much smaller margin for error. During the day, your cardiovascular system can compensate for stress and adjust when something is off. At night, many of those backup mechanisms are reduced. Your body is in a sense operating with fewer safety nets. This is exactly why small evening habits can have such a large impact. What you do in the hours before bed directly affects how your heart performs during the most vulnerable period of the night. Let us start with one of the most common habits I see in my patients. Eating a large heavy meal late in the evening. For many people, dinner happens at 8, 9, sometimes even 10 at night. It is often the biggest meal of the day, with carbohydrates, fats, and portions that require significant digestion. After that, there is very little movement, maybe some time on the couch, and then bed within an hour or two. From a cardiovascular perspective, this creates a problem. When you eat a large meal, your digestive system requires a substantial increase in blood flow. Your heart has to work harder, your blood pressure rises, and the level of fats in your blood increases sharply in the hours after eating. Now consider what happens when you lie down to sleep during this process. Your body is trying to transition into a resting state, but your heart is still working to support digestion. These two demands are in direct conflict. Over time, this pattern can lead to elevated nighttime blood pressure and increased strain on the heart during the exact hours when it should be recovering. The solution is not complicated. Aim to finish your main meal by 6 or 7 in the evening, and if you need to eat later, keep it light and easy to digest. This simple adjustment gives your cardiovascular system the time it needs to settle before sleep. The second habit is less obvious, but in many cases it is even more important. The timing of blood pressure medication. A large number of people over 60 take medication for hypertension, but very few have ever had a detailed conversation about when that medication should be taken. Most simply follow a routine of taking it in the morning, assuming that consistency is all that matters. In reality, timing can make a significant difference. Blood pressure follows a natural rhythm throughout the day, typically rising in the morning and falling at night. However, in many older adults, this nighttime drop does not occur as it should. In some cases, blood pressure remains elevated or even increases during the early morning hours. This condition, known as nocturnal hypertension, places additional stress on the arteries at a time when they are less protected. If medication is taken only in the morning, its effect may diminish during the night, leaving the cardiovascular system vulnerable during the most critical hours. This is why it is so important to speak with your doctor about timing. In some cases, taking medication in the evening can provide better protection during sleep. It is a simple conversation, but it can have a profound impact on your overall risk. The third habit is one that many people dismiss, even joke about, without realizing how serious it can be. Snoring. Most people think of it as nothing more than a nuisance, something that disturbs a partner's sleep or becomes a source of humor in the household. But in my field, I do not treat snoring lightly, especially in patients over 60. In many cases, it is a sign of a condition called sleep apnea, and this is one of the most underdiagnosed cardiac risk factors I encounter. What happens during sleep apnea is not subtle. The airway becomes partially or completely blocked, causing breathing to stop for several seconds at a time. This can happen dozens of times in a single hour. Each time it happens, oxygen levels in the blood drop, and the brain reacts as if the body is under threat. It triggers a stress response, releasing hormones that cause a sudden increase in heart rate and blood pressure. In effect, your heart is being jolted repeatedly throughout the night, even though you remain asleep and unaware. Over time, this repeated stress places a significant burden on the cardiovascular system. Sleep apnea has been strongly associated with a higher risk of heart attack, irregular heart rhythms, and stroke. The challenge is that many people do not recognize the signs. Yes, loud snoring is one, but there are others that are often overlooked, such as waking up feeling unrefreshed, experiencing morning headaches, or needing to use the bathroom frequently during the night. If any of these sound familiar, it is worth discussing with your doctor and considering a sleep evaluation. Treatment, often in the form of a device that supports breathing during sleep, can significantly reduce the strain on your heart. Even simple changes like sleeping on your side instead of your back can make a noticeable difference while you work toward a proper diagnosis. The fourth habit is something that comes from a place of logic, which is exactly why it is so easy to overlook. Many people intentionally reduce how much they drink in the evening to avoid waking up during the night. On the surface, This makes perfect sense. No one wants their sleep interrupted. And for older adults, getting up in the dark can increase the risk of falls. So fluids are limited sometimes after dinner, sometimes even earlier. From a cardiovascular standpoint, however, going to bed dehydrated can create a different kind of risk. When your body lacks adequate fluid, your blood becomes thicker and flows less easily through your vessels. In a younger, healthier system, this may not cause noticeable issues. But in someone over 60, where arteries may already be narrowed or less flexible, this change in blood viscosity can have more serious implications. Now, consider the timing. During sleep, your heart rate naturally slows and blood circulation becomes more gradual. When thicker blood moves through a system that is already operating at a slower pace, the conditions become more favorable for clot formation. This is one of the reasons why cardiovascular events often occur in the early morning hours. The solution here is simple and practical. Drinking a moderate amount of water before bed, even just one glass, can help maintain proper blood flow throughout the night. Keeping water nearby for when you wake up can also support your body's needs without significantly disrupting your sleep. It is not about drinking excessively, but about avoiding unnecessary dehydration during a time when your heart is already working under different conditions. The fifth habit is something most people have never connected to heart health at all, and that is the temperature of the room where you sleep. For most people, this is purely a matter of comfort. They adjust it based on how they feel, without ever considering what it might be doing to their cardiovascular system over the course of the night. But your body is constantly working to maintain a stable internal temperature. And when your environment is too far outside of an optimal range, your heart has to compensate. If the room is too warm, your body responds by trying to release heat. Blood vessels expand, your heart rate remains slightly elevated, and you may lose more fluid through sweating. Sleep also becomes lighter and more fragmented, reducing the amount of time your body spends in the deeper stages of rest where recovery is most effective. On the other hand, a room that is too cold creates a different kind of stress. Blood vessels constrict in an effort to preserve core body heat. This increases resistance within the circulatory system, forcing the heart to work harder to push blood through narrowed vessels. For someone with underlying cardiovascular issues, this added strain during the night is not insignificant. There is a range where your body operates most efficiently during sleep, and it is narrower than most people realize. Keeping your bedroom between 18 and 22 degrees Celsius allows your cardiovascular system to remain stable with relaxed vessels and a steady heart rate. It is a simple adjustment, but one that supports your heart throughout the entire night. The sixth habit is one that has become increasingly common, especially in recent years. Using screens right up until the moment you go to sleep. Phones, tablets, televisions, all of them emit light that directly affects your body's internal clock. Most people think of this in terms of sleep quality, but the impact extends beyond that. Exposure to bright light in the evening suppresses the production of melatonin, the hormone that signals your body to prepare for sleep. Without that signal, your nervous system remains more active than it should be. Your heart rate does not slow as effectively, and your body does not fully transition into its nighttime recovery mode. In addition to the light itself, the content you consume can also play a role. News, social media, or anything that stimulates emotional reactions can keep your mind engaged and your stress levels elevated. This creates a situation where you may be physically lying in bed, but your body is not truly at rest. Over time, this pattern can interfere with the natural rhythms that support cardiovascular health. The solution is straightforward. Give your body a buffer between screen use and sleep. Turning off devices at least 30 to 60 minutes before bed allows your system to gradually shift into a calmer state. Replacing that time with something more relaxing, such as reading or quiet conversation, can help your heart enter the night in a more stable condition. The seventh habit is one that seems almost too simple to matter, which is exactly why it is so often ignored. The position you sleep in. For many people, especially as they get older, sleeping on the back feels natural and comfortable. It is something they have done for years without ever questioning whether it could affect their health. But for individuals who are at risk of sleep apnea or who already experience snoring and breathing interruptions, sleeping on the back can make the problem significantly worse. In this position, gravity causes the airway to narrow more easily. The tongue and soft tissues in the throat fall backward, increasing the likelihood of partial or complete obstruction. What this means in practical terms is that breathing becomes more unstable during the night. Oxygen levels can drop more frequently, and the heart is subjected to repeated stress responses, just as we discussed earlier. Even if the episodes are not severe enough to fully wake you, they still place a burden on your cardiovascular system over time. For many people, simply changing sleep position can reduce the severity of these interruptions. Sleeping on your side helps keep the airway more open and allows for more consistent breathing throughout the night. It is not a complete solution for everyone, but it is a meaningful step, especially for those who have not yet been evaluated or treated. Now, when you step back and look at all 7 of these habits together, something important becomes clear. None of them are extreme. None of them require drastic lifestyle changes or complicated interventions. What they represent is a pattern, a sequence of small decisions that shape how your heart experiences the night. Instead of thinking about these as separate issues, it can be more helpful to see them as part of a simple evening routine, a structure that supports your cardiovascular system in the hours leading up to sleep. That routine might begin with finishing your main meal earlier in the evening, giving your body enough time to digest before you lie down. It continues with making sure your medications are taken at the right time based on guidance from your doctor. It includes creating a calm period before bed, stepping away from screens, and allowing your body to naturally prepare for sleep. It also involves small environmental adjustments, like setting the room to a comfortable temperature and keeping a glass of water nearby to avoid dehydration. And finally, it extends to how you position your body when you sleep, making sure you are not unintentionally placing additional strain on your breathing and your heart. Individually, each of these steps may seem minor, but together they form a system. One that reduces unnecessary stress on your cardiovascular system and gives your heart the conditions it needs to recover properly during the night. I want to leave you with something a little more personal, not just as a surgeon, but as someone who has spent more than 2 decades watching how these stories unfold. There have been nights when I stood in an operating room in the early hours of the morning, working on a heart that had stopped without warning. And what stayed with me was not just the medical urgency, but the conversations that followed. Families sitting in silence, trying to understand how a completely normal evening could turn into something life-changing just a few hours later. In many of those cases, when we looked closely, the causes were not mysterious. They were patterns, small, repeated habits that had been building up over time. A late meal here, missed or poorly timed medication, their years of untreated snoring, a body going to bed slightly dehydrated night after night. None of these seemed serious on their own. But together, they created conditions the heart simply could not sustain forever. And if I am being completely honest with you, this is the part that affects me the most, because so many of these situations could have been prevented if the right information had reached the right person at the right time. So my perspective is simple. This is not about fear. It is about awareness. Your heart does not suddenly fail without reason. In many cases, it responds to patterns, to routines, to decisions that feel small in the moment but become significant over time. That is why I want you to think of these 7 habits not as a list but as a choice. A choice about how you prepare your body for the most vulnerable hours of the day. Because what you do before you go to sleep matters more than most people realize. Now, let's bring it back to something practical. 7 habits, 7 adjustments. Finish your main meal earlier. Speak with your doctor about the timing of your blood pressure medication. Take snoring seriously and get evaluated if needed. Stay properly hydrated before bed. Keep your sleeping environment within a healthy temperature range. Step away from screens before sleep. And be mindful of your sleeping position. If even 2 or 3 of these sound familiar, that is not a failure. It is an opportunity to make a change. I would like you to take a moment and think about your own routine tonight. Which of these habits are part of your evening? And which ones are you willing to adjust starting today? If you found this helpful, consider sharing it with someone who might need it. A parent, a partner, a friend over 60. Because sometimes the right information shared at the right moment can make a real difference. And one final thing. Everything I have shared here is based on general medical knowledge and my clinical experience. It is not a substitute for personalized medical advice. If you are considering changes to your medication, your sleep habits, or anything related to your health, please speak directly with your doctor. Not because it is a formality, but because your situation is unique and it deserves individual attention. Your heart has been working for you every minute of every night for your entire life. The question is whether you are giving it the conditions it needs to keep doing that safely. Start tonight.